Hey Doc, this is Dr. Gideon, just finally getting back to the office. Sorry for the delay, just wanted to shoot a quick little video of our, exactly like that video I sent you the other day. So this is kind of the setup that we have in my office. We do keep track of all our patients. We just created this little kind of spreadsheet with the name, the date, the affected area, and kind of what settings that we were using before. It's fairly easy when you come in here to set up and calibrate everything. Like, let's see here. You're just gonna go, really the biggest thing you're gonna change is energy, which is that number. The amount of shocks. We normally do 500 at a time. Normally, depending on the joint, we'll do 500 minimum. On bigger joints, if you're doing bilateral like a lumbar spine, we can bump that up to 2,000. And that way it just keeps track of how many total shocks that you're actually gonna do. But we normally leave this at 500 and we just kind of feel the patient out, because sometimes they can tolerate more, sometimes they can tolerate less. And then we'll bump the energy up depending upon their comfort level. I want them to feel it, but I don't want it to hurt. And then this is the wand right here. Again, touch screen, or not touch screen, but just simple touch. You can turn that on and off at any time. And then we've got the different heads that we use. This one we use 95% of the time, the basic head. So say if we were treating my knee, we would put the ultrasound gel on. This has become my favorite brand, is this one. So you just put a dab of it on the body part. You tend to want to be a little bit more liberal with this, and then you would just come here, push the button. You can hear it engaging. The fan cuts on, and then you can see the shock counter continues. And then you're just going to use with the gel. Since I don't have gel on, I wasn't going to use it, but. And you're going to really focus, on the area of pain, maybe within a 2-inch radius or diameter. But you want to focus it on the boo-boo, on the area. So if it's like a medial meniscus or lateral, you really focus more on here, lumbar SI joints. We use this on pretty much every body part. So it's pretty simple machine to use. Hopefully that helps. If you have any other questions, let me know. We don't use a lot of the pre-saved algorithms. You can have some different settings on that, for specific body parts, but we tend to keep it pretty easy, and we just bump the energy up or down, on the more sensitive areas, less on the bigger, thicker muscle body parts. They can handle quite a bit more. And let's see what it maxes out. Yeah, it maxes, you'll never go above 0.55. And then that's also going to, the hertz, it automatically adjusts that. So you don't really need to worry about messing with the hertz. It's gonna adjust that depending upon the amount of energy that you're using. And then you can see total shocks and then the joules applied during the treatment right there. So hopefully that helps. Let me know if you have any questions. Thanks.